It's Jordan Sanchez from the Revolution Morning Show, and I am here with family medicine practitioner, Dr. Michael Yurubi. How's it going, doctor?
Good, and you? How are you?
I'm doing great. Thank you so much for taking the time to sit down with me and talk about the coronavirus.
No, thank you for having me on.
Absolutely. So I wanted to ask you a couple of questions about the coronavirus and specifically about symptoms. What are the symptoms that people have to look out for when it comes to this?
So the most common symptoms people are experiencing is mostly fever. I mean, you can have a moderate fever. Anything over 100.4 is considered a fever, and then a productive cough is what they're having. So the alarming symptoms that people should be worried about is any kind of shortness of breath. Those are the main symptoms that people are complaining of. There has been some GI symptoms that people have been also complaining about, but mostly the main thing that people want to take into consideration is mostly fever, cough, and not so much upper respiratory or body aches.
Okay, so if you are experiencing these symptoms, what is the proper procedure when it comes to getting a test for coronavirus?
So the main thing that people should know is that if you're just having fevers, coughs, body aches, and you're a young, usually healthy person, it's okay to just kind of stay home and relax. The most people that are being tested right now are anybody that's 65 and older that has any kind of comorbidities, meaning any kind of diabetes, heart disease, COPD. These are the people that with symptoms, with these symptoms are the ones that are being tested right now. Other than that, it's other people that are having symptoms and also have been in contact with somebody that have COVID-19.
So if you're at home and you feel like you have these symptoms coming on, but you haven't traveled or you haven't come in contact with anyone that you know that might have it, you should not get tested. Is that what you're saying?
Yes. Right now, according to the CDC, if you're having these symptoms, you should probably just stay home, quarantine yourself for 14 days. Take the same precautions that you would take if you had the flu. Stay away from people, relax. Most of the symptoms are really mild to moderate, not needing any kind of hospitalization. So the most important thing is kind of stay home. Don't expose yourself going out, trying to get tested in the emergency room. Don't expose yourself and everybody else around you if you're feeling sick. I'm working in a hospital. The main people that I see are people that are worried. They feel like they got exposed to somebody who had COVID-19. They're coming into the hospital completely asymptomatic and they want to get tested. And these are the people that really shouldn't be tested because really you're asymptomatic. Stay home and then just kind of quarantine yourself and don't make the exposure worse for everybody else. It could be COVID-19, but they wouldn't meet criteria anyway to be admitted into the hospital. So the main thing is to stay home and limit the exposure to everybody else.
And what is the importance of limiting the exposure? How contagious is COVID-19?
So right now it is very contagious. The worst part about it is that the incubation time, which is the time from you getting exposed to the virus and having the virus in you to the time that you experience symptoms, is between 6 days to even 14 days. So you can have this virus walking around asymptomatic and you're spreading the virus around.
Well, thank you so much, Dr. Yurubi. I really appreciate you taking the time to sit down and talk with me.
Thank you very much, Jordan.